So we had one. My name is Alison Krentel. I'm an assistant professor at the School of Epidemiology and Public Health at the University of Ottawa, and I'm a scientist also at the Brocher Research Institute. So this event is co-hosted by the University of Ottawa and the School of Epi and Public Health, Brocher Research Institute, and the International Global Health Office at the Faculty of Medicine, and also the WHO Collaborating Center for Knowledge Translation, Health Technology Assessment, and Health Equity. So welcome, everyone. Before we begin, we want to pay respect to the Algonquin people, who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. We acknowledge the traditional knowledge keepers, both young and old. We honor their courageous leaders, past, present, and future. So as we begin today, I've already introduced the Global Health Learning Network. This is a monthly seminar series that focuses on global health work that is being done here in Ottawa by our partners around the world. And so if you have a research topic or an interesting guest that you would like to put forward to the committee, please do feel free to let us know. We're always interested to share a lot of the global health experiences that we are having and the research that we're doing. So launching our series today is Dr. Manisha Kulkarni. Dr. Kulkarni is Assistant Dean of Global Health within the University of Ottawa Faculty of Medicine. In this role, she's expanded initiatives under the Global Health Program based within the International and Global Health Office with a focus on fostering equitable global health partnerships. Dr. Kulkarni is also an associate professor in the School of Epidemiology and Public Health at the University of Ottawa and holds a PhD in medical entomology from McGill University. She's worked extensively on malaria biology, epidemiology, and control in East Africa. So welcome, Manisha, and over to you. And for today's webinar, we'll be predominantly speaking English, but questions can be offered in both languages. So thanks, Manisha, over to you.
Thanks so much, Alison, for that introduction. I am very happy to be here today to be opening our Global Health Learning Network for this academic year by providing an overview of the Global Health Program within the Faculty of Medicine. Many of you may be familiar with our Global Health Program who are in the faculty or in the university, but this webinar I hope will reach some external audiences as well. So I welcome any questions at the end of the webinar, and we'll also have time for a quick evaluation. So today I'll talk a little bit about the history of our Global Health Program, our vision, missions, and values, and as it relates to the Brocher Declaration, the governance of our program. I'll introduce a few of our special initiatives and partnerships, as well as the program learning objectives and learner and faculty opportunities that we are supporting through our Global Health Program. So in terms of history, the program was first established in 2009 in the Faculty of Medicine as the Office of Global Health. And this aims really to further global health activities within the faculty, focusing on medical education, including undergraduate and postgraduate curriculum development, and managing international electives for medical students. Since about 2018, the Global Health Program has been based in the International and Global Health Office, and we are working to build the program in alignment with the Faculty of Medicine strategic priorities, according to the latest strategic plan, including the strategic priority on internationalization and global health. So we, to do this, expanded the scope of the Global Health Program as of 2020, when I came on as the interim director. And we are working in close collaboration with the Office of Social Accountability and their Director of Planetary Health. So this just shows our strategic plan for the Faculty of Medicine with our 5 strategic priorities, including the 5th one, internationalization and global health. So under this pillar, we have several strategic goals and activities, including ensuring impactful and diverse partnerships, improving global health locally and abroad, prioritizing our social accountability mandate, and empowering our learners for global citizenship. So really all of our activities and efforts are focused around these different strategic goals. Our vision for the Global Health Program is really to have a vibrant multidisciplinary group of Faculty of Medicine members and learners that can contribute to the improvement of health and health equity globally. We do this by serving as a knowledge hub and facilitator of global health learning and experiences for all Faculty of Medicine members and learners, and contribute to the Faculty of Medicine's mission to expand its global health leadership. All of our activities are centered around a set of values, including equity and fairness, authentic and sustainable partnerships, capacity strengthening and knowledge sharing, and interdisciplinarity. So these align very closely with the CCGHR principles for global health research and some of the new frameworks for ethical global health work that we'll talk about, including the Brocher Declaration. So the Brocher Declaration is a statement of ethical principles to guide global health engagements. And in October 2021, through the Faculty of Medicine, Ottawa became the first Canadian university to sign on and endorse the Brocher Declaration, and really endorse this set of principles, including mutual partnership with bidirectional input and learning, empowered host country and community that define the needs and activities of global health engagements, sustainable programs and capacity building, compliance with laws and ethical standards, humility, cultural sensitivity and respect, as well as accountability for actions. Our Global Health Program leadership and governance is based in the International Global Health Office within the faculty. Dr. Mark Walker is our Vice Dean of Internationalization and Global Health, and he chairs the Advisory Committee on Internationalization. I work closely with Dr. Walker in my capacity as the Assistant Dean of Global Health, and I chair the Global Health Advisory Committee. In my role, I also participate in some national global health networks, including the AFMC, the Association of Faculties of Medicine of Canada Global Health Network, as well as the CAGH, the Canadian Association for Global Health University Advisory Council. Our Global Health Advisory Committee is a really important and diverse group of faculty and learners from the Faculty of Medicine that have the role of aiding our program in achieving our strategic goals and objectives by providing guidance, insight, and expertise to enhance current global health programs and to identify new opportunities in the areas of education, research, and community engagement. We have faculty and members from across our clinical departments, our School of Epi and Public Health, our basic science departments, as well as postgraduate medical learners, undergraduate medical learners, and graduate students. Our Global Health Advisory Committee, importantly, plays a role in evaluating new partnership proposals based on our preferred partnership strategy. We also have a Clinical Global Health Council, which is playing a very important role within our faculty, since our Faculty of Medicine is comprised both of clinical departments with affiliated hospitals and research institutes, as well as our School of Epidemiology and Public Health and other basic science, biomedical science departments. So the clinical departments have this council that has representatives from each department, and the role is really to facilitate knowledge exchange and cooperation on clinical global health activities across the faculty. We have two co-chairs, Dr. Yvonne Ying and Dr. Dylan Bould, who are leading this council and playing a really important role in coordinating clinical global health activities. We also have a number of special initiatives. One is the FAIR Task Force. So this is a really important initiative that was launched in the last year, co-chaired by Dr. Alison Krentel and Dr. Fawad Akbari. And FAIR stands for Fairness and Anti-Racism to Enhance Academic Research, Partnerships, and Education in Global Health. And this is a task force that seeks to make recommendations for a faculty development strategy to ensure equity in global health across our Faculty of Medicine partnerships, research, and education. We also have our Global Health Learning Network, which you are attending the webinar today, which is a platform for knowledge exchange and growth with the goal to build a community of practice in global health that reaches across researchers and practitioners and learners from all global health domains to include members of the public with an interest in global health. And our steering committee members are shown here. Our program objectives broadly with our global health program, since we're not an academic unit ourselves, it's really to support the global health activities engagements that are happening across the Faculty of Medicine. We have so many faculty members that are involved in global health work in various capacities, both in clinical and non-clinical. And so our program's goals are really to support and identify synergies for global health across the Faculty of Medicine. Our partnerships, education and knowledge exchange activities all fall under these different pillars. With our partnerships, looking to ensure impactful and equitable global health partnerships that adhere to our Brocher Declaration principles, educational initiatives that contribute to educational strategies within the Faculty of Medicine programs, and importantly, supporting experiential learning opportunities for our Faculty of Medicine learners. And as far as knowledge exchange, we act as a hub of information and knowledge to facilitate this exchange of ideas and collaborative activities. The preferred partnership strategy is something that we developed in 2020, and this is really a change from the previous model where we had many different activities that learners were engaging with largely independently in terms of electives in different countries. We've tried to consolidate some of these activities in a preferred partnership model based on a partnership strategy to form these partnerships as a primary platform for Faculty of Medicine learners with a desire for global health engagement. These partnerships emphasize reciprocity and shared benefits, and as such, we provide opportunities for bidirectional exchange of faculty and learners from our partnership institutions. And these serve as a means really to contribute to global health needs and health equity as defined by our partners in a collaborative manner. And the evaluation metrics, we have a set of different metrics that are used to evaluate partnerships, and one of them is detailed here. So some examples of our partnerships of focus include partnerships in Benin with Université d'Abomey-Calavi and the Institut Régional de Santé Publique, IRSP, in collaboration with Francophone Affairs and Family Medicine, as well as Kilimanjaro Christian Medical University College in Tanzania. However, there are a number of different partnerships within and between individual departments in the Faculty of Medicine. These are examples of partnerships that we have focused activities where we're trying to consolidate learner opportunities and bidirectional exchange. So the first example is with the Faculté de Sciences de la Santé at Université d'Abomey-Calavi in Benin, in Cotonou. The MOU was originally signed in 2004, and so there's been a lot of ongoing work with clinical faculty led by Dr. Marie-Hélène Chaumienne and others in family medicine and Francophone affairs. So the activities include clinical electives in family medicine, pediatrics, psychiatry, obstetrics and gynecology, as well as surgery. About 85 learners, including 12 residents, have participated in activities in Benin to date, and faculty members have also participated in MD thesis committees, lectures, manuscript reviews, and other activities for capacity building. Our partnership with the IRSP in Benin is based on a MOU that was signed in 2007. There have been a number of different activities and collaborative research projects that have been initiated in collaboration between U-Ottawa faculty and IRSP over the years. Last year, our Global Health Program provided support to IRSP learners and faculty to attend the McGill and U-Ottawa course in health system strengthening that was led by Jan Hatcher-Roberts as part of the McGill Summer Institutes in Global Health. So that was a very exciting way that we could support our partners in times where we weren't able to actually have bidirectional travel due to the pandemic travel restrictions. We have prospective partnership activities that we're looking to engage with our partners in the coming years, including student exchanges for public health practicums and studentships, and joint workshops and conferences as well. Another activity that has been implemented in Benin is a project Mérieux that is conducting training workshops for physicians and other healthcare professionals in primary healthcare with a focus on communicable diseases. And about 66 participating health professionals have been engaged to date, covering a variety of topics, including infection control, post-surgical infections, antibiotic prophylaxis, and other topics. One new partnership that we want to highlight is with Kilimanjaro Christian Medical University College in Tanzania. This is a new MOU that was signed in 2021, and we're looking to build a long-term sustainable partnership that provides opportunities for collaboration and reciprocal student and faculty exchanges in education, research, and clinical care. This KCMU Co is affiliated with Kilimanjaro Christian Medical Center, which is the regional referral hospital in northern Tanzania, serving over 15 million people. It has an Institute of Public Health with various departments and graduate programs, which we are looking to collaborate with and engage. We have some upcoming partnership activities, including a delegation of faculty members traveling to Moshi in October this year to formalize our partnership and promote clinical and public health collaborations. So this is really exciting. We have a number of different departments that are participating from the faculty, including anesthesiology, emergency medicine, internal medicine, obstetrics and gynecology, the School of Epidemiology and Public Health and Surgery, and we'll be able to really begin to develop some of our bidirectional priorities for the years to come. There are a number of other global health partnerships. I won't be able to mention them all, but there are a couple of note. For example, our Department of Family Medicine has a partnership with Guyana Ministry of Public Health in the Institute of Health Science Education, as well as Georgetown Public Hospital Corporation with an MOU that was signed in 2014 and is under renewal. There have been a number of activities here, including supporting the graduation of 3 cohorts of family physicians and integrating the principles of evidence-based medicine into primary care. The photo on the right shows a very recent signing ceremony, which was very exciting, a partnership between the Department of Family Medicine and our Faculty of Medicine and the Brocher Center for Global Family Medicine. So this new MOU will promote collaboration between our university and the College of Family Physicians of Canada. We have a number of different activities that fall under our education and knowledge exchange pillar. One of the most important is our concentration in global health and social accountability. We also offer funding to support global health research and mobility, our Global Health Learning Network, as well as a Global Health Journal Club. The concentration in global health and social accountability was launched formally in the fall of 2021. It builds on a previous iteration, which was called the Global Health Concentration. The scope of the concentration has been expanded to include activities in social accountability, planetary health, and Indigenous health, building really on the interests and demands from our learners that want more experience in these areas. It's open to all Faculty of Medicine learners, so we welcome students from graduate programs, from undergraduate medical and postgraduate medical programs. And what we have is a set of experiential learning activities that promote interprofessional, interdisciplinary learning. So by completing activities, learners can accumulate points towards the concentration and earn a certificate of achievement. This is a non-credit program, so it's extracurricular, but it's highly complementary to the global health curricula that are within the core programs themselves. Currently, we have about 33 students registered in the concentration. 9 students recently completed the previous concentration in the last year, and you can see the breakdown of registrants by program. Activities include earning points by doing volunteer work, by attending monthly meetings of our student-focused Global Health Journal Club, by attending sessions of the Global Health Learning Network and other conferences and webinars related to global health, by engaging in a global health or social accountability placement or elective, which includes pre-departure training as well as a post-elective debriefing. our SANYAS, we support students to register in the SANYAS Anti-Racism Indigenous Cultural Safety Training Program, as well as support learners to engage in an annual CIMEX event. This is a fully immersive humanitarian simulation training event that is delivered by Humanitarian Partners International. So our global health and social accountability electives and placements are really focusing with our preferred partner institutions in Benin and Tanzania at the moment to build up opportunities for our learners to engage in activities in those institutions, and for learners from those institutions to come to Ottawa to engage in learning opportunities here. We provide funding for undergraduate medical students through the Global Health Student Builder Fund with bursaries for summer studentships, conference participation, as well as global health electives in Canada and abroad, as well as funding opportunities for graduate students through the Advancements in Global Health Studentship Program for master's and PhD students. Some examples of funded projects this year are provided here. So there are a wide range of different projects related to student theses and research that are supervised by Faculty of Medicine faculty members. New this year, we'll be providing funding for an MPH public health practicum in Moshi, Tanzania, which is very exciting. And last but not least, just to give a bit of a plug for future Global Health Learning Network webinars, we'll be welcoming colleagues from abroad, as well as members from our Global Health Clinical Council and faculty members in the Faculty of Medicine to speak about their work in global health. October 20th, next month, we'll have Dr. Alfredo Walker talking about COVID and postmortem considerations of performing autopsies on COVID-positive decedents from our Department of Pathology. We'll have Dr. Alison Krentel talking about her project from Grand Challenges Canada in Madagascar and Ghana, and that's in November. And then in December, Zikazi Nduna from South Africa will be coming to talk about sexual victimization, mental health, and risky sexual behaviors in research in South Africa. So some very exciting speakers lined up, and we'll be announcing on our website what the speakers are for the winter program as well. That will be coming up soon. So I'm really happy to be sharing this information with you today. I'm really glad that everybody could join. If you do have any questions or would like to find more information about the Global Health Program, you can contact us at the email address listed here, or go on the University of Ottawa website, find more information about our program. And perhaps before we go, I'll just answer any questions that you might have, and then we'll have some time for a quick evaluation of the webinars to guide our future directions. Thank you very much.
It was a great overview, and a lot is happening. So it's very exciting to see all these different developments going forward. I did not indicate in the beginning if there were to put your questions in the chat or put your hand up. So, but I can see that there's already a hand up. So I'll hand back to you, Manisha, on that.
Great, thanks so much. I'm just going to look at the questions in the chat first. Is a question from Lena. For the international electives, can students participate in them during their third and fourth year or before them? That's a great question. So for medical students, we are developing community-based elective opportunities for first and second year pre-clerkship in Tanzania at the moment, hoping to launch that first cohort in 2023. We do have opportunities for third and fourth year medical students as well as graduate students to do placements related to thesis research.
Manisha, there's a hand up with Jan Hatcher-Roberts.
Hi, Jan.
Actually, yeah, I put Saber's name because he's also participating, but I had a question. Two things. One, can you find out what the specific evaluations are from the Tanzanian participants for the McGill course? Because it was anonymous, and I'd like to know from our point of view, University of Ottawa point of view, whether this was useful for that group in continuing or what else, you know, they'd like to see. So if I wouldn't mind, they don't have to give me their names, but even I could have it as a block, that would be very informative. And the other thing is the simulation, the humanitarian simulation. Who's the contact point for that? Is that through
It's
health?
through our office.
Okay.
Yeah, so we're organizing that. That's actually next weekend, so it's very
Oh.
exciting, coming up quite quickly.
Can anybody go to it, or?
We have 30 places for students, but we also have opportunities for faculty members to come and serve as evaluators. So if you're interested, please reach out to MJ.
I was thinking of Saber, who's from Afghanistan. He would be
wonderful.
Kind of an in-between, but maybe that would be great. So we'll reach out to you or to the IG?
To Maria Jose at globalhealth@uottawa.ca.
Okay. Yeah. All right. So that might be really fun for you, Saber. Yeah. Fun. Well,
thank you.
Yeah, so that's a really exciting opportunity. We had partnered with the Humanitarian Partners International through our undergraduate medical global health interest group in the previous year to do a virtual humanitarian simulation training. So this one will actually be an in-person full-day simulation event simulating a refugee crisis scenario where the students will get to learn about the humanitarian core concepts and principles and engage in small teams to really react to an unfolding situation. So it's going to be a really exciting event.
And it will be in Ottawa?
And it will be in Ottawa, yes, at the Lees campus at the University of Ottawa. And as it says in the chat there, MJ just put a note for questions about the SIMX. You can contact her at globalhealth@uottawa.ca. I see one more question. I can't see everybody's hands, so please, MJ, if there are other hands, let me know. But I do see a question from Constance. How do medical students sign up for the concentration in global health and social accountability? Great question. Again, please do contact Maria Jose, MJ, at globalhealth@uottawa.ca. You can find more information on the Global Health Program website. Maybe, MJ, can you put the link there for our website as well, just to if you want to look for information quickly about the concentration, that's a great place to start. You can register anytime throughout the academic year, and you can complete the concentration over the duration of your program. So if you're in a an MPH program, you can complete it in 1.5 years, or master's 2 years, PhD 4 years, medical program 4 years. So it can stretch over the duration of your academic year and program. Great, thanks, MJ.
Manisha, I have a question for you.
Go for it.
Just for different people who are on the call today who may have a long-standing relationship with a university or research partners in different parts of the world, and if they wanted to bring a potential partnership forward, is there a mechanism that faculty can go through in order to introduce potential preferred partners to IGO?
Yeah, that's a great question. We do have a form, actually a web form on the IGO website to request evaluation of new partnership proposals. So these partnership proposals are generally generated between a faculty member at the Faculty of Medicine and a colleague at a partner university in order to give a bit of background information on the types of activities, whether there's funding available for it, the types of engagement that you would be looking to support through the partnership. And then we can get in touch with you directly for more information and bring that to our Global Health Advisory Committee to look at those partnership requests. As I mentioned, these partnerships are really important. They form really the backbone of our global health program by providing opportunities for faculties, members, and learners to engage in global health activities that really serve the needs of our partners and the communities that they serve. So we're trying to identify those priorities with our partners in Tanzania at the moment, so that we can engage in multiple levels, both in terms of clinical capacity building, public health capacity building, teaching and research across different interdisciplinary threads. Any other questions?
There's one more that's
One
just
from
come into the
Morgana.
chat. Yeah.
Yeah, perfect. Thanks. Should prospective students applying for a master's at the University of Ottawa mention their interest in the global health concentration? Absolutely. You can mention your interest in global health and in the global health concentration. There are not limited spots. The only place where we do have limited spots are for some of the funded activities. So we're able to support a small number of students to subsidize their registration costs for the SANYAS training, for example, as well as to participate in the CIMEX. We have 30 spaces that we're able to fund. But all of the other activities, you can engage in those. There's no limit to the number of students who can be enrolled at a time. You can also look at Faculty of Medicine website at the other educational programs if you're interested in studying in global health, for example. If you're looking to do a master's in public health, we have a global health stream within the School of Epidemiology and Public Health, as well as within the Masters of Epidemiology program. You can also take those same global health courses. So there are a number of different opportunities to learn either through your core educational program or by engaging in the extracurricular activities through the concentration. Many students do both, which is a really great way to enhance your global health training and to really build a network across different disciplines. Great. So I guess if there are no other questions, I'll just say, thanks again for joining in today and hearing about our global health program. This recording will be posted for those who weren't able to join in person. And please do tune in for our upcoming Global Health Learning Network webinars, where we will be able to showcase a lot of the global health work being done by our faculty members. That, of course, we could not capture in this presentation, but there's a wide range of global health activities going on across all of our departments and schools that we hope to showcase, as well as initiatives from some of our colleagues overseas, of course. So please do tune in, save the date for those next webinars. And just before we go, MJ is going to launch a quick evaluation poll. So please do fill that in and give us any feedback for our future webinars. We'd really appreciate that.
Thanks very much.
Great. Thanks, everyone.